Hi, my name is Amy Carpenter. I'm currently enrolled in Nursing 302 Business of Healthcare, taught by Professor Rebecca Riley in the nursing program at McNeese State University. Today, I will be discussing the United States healthcare delivery system. According to our class text by Shi and Singh, the healthcare delivery system is comprised of four functional components: financing, insurance, delivery, and payment. These four functions usually overlap, but the amount of overlap depends on whether we are discussing private or government-run systems, and traditional health insurance or managed care-based systems. The four functions. The first function of the healthcare delivery system I will discuss is financing. Examples of financing can be employment-based insurance, private plans that you can pay out of pocket for, or public programs. The second function is insurance. Insurance helps provide services when needed. It specifies how and where healthcare services can be received. The next function is delivery of healthcare, which involves the services provided by the providers. Providers can be doctors, dentists, labs, medical equipment companies. The last function is payment. This is basically how providers are reimbursed. The insurer determines how much is paid per service. With private or employer-based plans, there are things such as out-of-pocket premiums an individual will have to pay. Providers can also be reimbursed from the government via Medicare and Medicaid. According to Madev et al., healthcare delivery has moved from the home to the hospital and has grown in response to the healthcare needs of an expanding middle class. Modern evidence-based medicine, with increasing utilization of technology and techniques, has improved the quality of medical care, but at a cost. That's a quote from Madev et al. So understanding the healthcare delivery system is important for us because as nurses, changes in the system can directly affect our role in healthcare. As nurse professionals, we need to be aware of the structure of the healthcare delivery system so we can understand it and be a part of it to help our patients get the best care possible. When we mention the word equity regarding healthcare in the coming slides, we mean, and this is a direct quote from Dawes, providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. Providers. Providers are any entity that delivers healthcare services and either independently bills for those services or is supported through tax revenues. That's a quote from Shi and Singh. According to Baker, providers can be doctors, nurse practitioners, dentists, physical therapists, labs, diagnostic centers, to name a few. Providers offer services to prevent disease and improve population health. Providers require different levels of training and they work in a variety of settings. They can either complement or substitute the work that's done by physicians. Some providers create inequity by only accepting patients with certain insurance plans. Others may address it by providing care to patients with any form of insurance. Some providers choose to work with only government reimbursed organizations, while others work with only privately reimbursed organizations. Many providers choose to have their practices located in the city, where they can see more patients in a day, thus get reimbursed more. However, this puts patients living in the rural areas at a disadvantage. Moving along to settings. Inpatient settings, outpatient settings, and long-term care settings are what we'll be discussing next. According to our text from Shi and Singh, the term inpatient is used in conjunction with an overnight stay in a healthcare facility, such as a hospital, whereas outpatient refers to services provided while the patient is not lodged in a healthcare facility. Some examples of outpatient settings are diagnostic clinics, dialysis centers, dentists, podiatrists, optometrists, blood banks, and mental health and substance abuse centers. Long-term care is not an isolated service. It involves various settings and services such as home health and physical therapy, or a few months stay at a local nursing home to receive more frequent, intense physical therapy and occupational therapy. Settings and how they create or address inequity. Most inpatient settings address inequity by allowing anyone to come to the ER and receive treatment regardless of coverage. However, uninsured patients may not receive the same kind of care. They might not receive the same kind of diagnostics or even treatment plans as someone who, say, went to the ER that does have insurance. Most outpatient settings do not see or accept patients that don't have insurance, unless they can provide payment up front. Long-term care settings are not available to the average elderly American due to most of them being above the federal poverty level. Purchasers. So when it comes to purchasers, there are private and public ones. I'll be discussing government, insurance, and individual. Public health insurance is provided by the government. So some examples of public health insurance, according to Georgia Vec, are Medicare, Medicaid, the CHIP, which is the Children's Health Insurance Program, and the ACA, or the Affordable Care Act, which is now known as America's HealthCare Act. Health insurance is either employer-sponsored or purchased by someone privately. So a lot of people that work full-time have the option of getting insurance through their company. And usually the fee for that is automatically deducted from the paycheck, maybe every other week. Some people, their employer doesn't offer insurance, or they might not be employed, and you have individuals that will pay out of pocket for an insurance plan. Public health insurance recognizes that preventative medicine and early interventions can save money and lives. Under the Affordable Care Act, according to Dawes, insurers participating in the federal exchanges are required to reward healthcare providers for programs that reduce health disparities. Dawes also states the Affordable Care Act prioritized equity as a legal requirement by including 62 provisions specifically designed to reduce and eliminate health disparities among racial and ethnic minorities and other vulnerable populations. Due to the expanding middle class and the increasing costs related to the improvements in modern medicine, we can expect costs to increase with providing quality healthcare coverage. A quote from Madev et al. Collaborative efforts among hospitals, physicians, and politicians will be critical to help map out future reforms. The path of healthcare delivery in the United States has had many changes over the years, but the outlook is still unclear. Thank you.